when Alex is ready to fight the sleep, his mode of fighting the sleep is running up and down and have uncontrollable laughter that just really don't make any sense. You don't know him get any joke and him just a laugh. Welcome back to our channel, and thank you once again for joining us in this another day in the life of living on Autistic Edge. I am Terry and Elaine, proud autism mom, and we are here to share with you tips and tricks of how we navigate through our journey right here on Autistic Edge. Managing sleeping disorder or insomnia, some persons would refer to it as, with children on the autism spectrum can be very challenging. The sleeping disorder can be challenging for the child. It can be challenging for the parents. It can be challenging for siblings and other. A matter of fact, it can be challenging for the whole family. Some persons cannot function effectively when they don't get enough sleep. Today, we want to share with you some strategies that can help with the improvement of the sleep quality. Most of these strategies, we have tried them ourselves and we have gotten some results. Now, we share with you when we start getting results. So even if it's not perfect, once it's working, we will share with you. All right. Now, strategy number one, establish a bedtime routine. Now, creating a calming and predictable routine before bed, and notice the word predictability. Remember, children on the spectrum like routine. The routine may include like a warm bath or a cold bath, depending on which one your child prefers. Again, know your child, know what their preferences are. So for some, it can be a cold bath. For some, it can be a warm bath. I find that the warm bath can be a little bit more soothing on the body, right? So you have a bath, you brush their teeth, you may be reading a book. I have heard parents say they have used the diffuser and they may use like essential oils in their diffuser, for example, like the lavender that gives that calming and soothing effect. Reading a book, I like to sing little bedtime songs for Alex as well, and we used to find that that was a little soothing for him. Number two, be consistent. I try to separate number two from number one, and I may have said some elements of this in number one, but I want to reiterate this as a point by itself. Be consistent with the routine. We have heard many parents who have tried something, you have a discussion with them and you share a tip or two, and they might say, okay, I'm going to try this tip. And they try the tip 2-3 nights and they will tell you, boy, I try 3 nights or 2 nights and it just never works. The reality is some children take longer to adapt to the routine than some. Remember, every child is different, right? So be consistent with the routine. Keep the same sleep and wake pattern time every day. And even on weekends, I know that on weekends is going to be your time when we sleep a little bit more late for the family to get a little extra moment in bed. But for the autistic children, if they are on a pattern, they're going to get up at the same time. All right. So be consistent with your routine so that it can be very adaptive and predictable. Number three, create a friendly environment. Make sure that the bedroom is comfortable. Ensure that the room is dark or the lights are low. So even if you're not getting dark, you may have low lights. Be careful of the color lights that you use in the room, because some lights will create further sensory issues or stimulate certain sensory issues and might just get them a little hyperactive rather than getting them to sleep. I think I've read somewhere that the red light is a much better light to use if you are using colored lights, right? But if you're not using colored lights, whatever lights you use, make sure that it's very low, because what you really need is a glow, and that is if you have to use a light. All right. Some people use night lights. Make sure if you're using night lights, they are low lights, very dim. You can use dimmable lights as well, because that does the trick. Now, ensure that the room is dark. So if you're living, say, near a street light where you just have one of those bright lights on the post outside, or you want to minimize the light that comes in through your window, so it's best to use like blackout curtains. Now I'll drop a link below of the curtains that we use in Alex's room. Now we have changed curtains over time, and these are the best curtains that gives us the proper blackout in his room. Ever since we found these curtains, we use different colors if we are changing the color codes in his room, but we stick to this particular curtain. All right, so it's one of the best, and there are others out there, but this is the one that we have used, and it has done exceptionally well in blocking out the light. So even when it's morning light, in our rooms will always look like night is still on. Yeah, it's still dark. It's that good. All right, so look at your lighting issue there, and use some blackout curtains to help. Now the bed linen, pay attention to your bed linen. Some children, they have a reaction to texture, a certain texture. So you want to make sure that it is as comfortable as possible. Now Alex likes to cuddle, and I myself, I love blankets. So I like to be warm and fuzzy and cozy and everything going into bed. And what we find is that Alex tends to like that as well. So from time to time, we'll cuddle him in, and we'll also use a blanket. Now, tell you a little secret about myself. I have a little fixation to blanket. Me not change blanket easy. my blanket have to be of a particular texture, and I not change blanket very easy. So I have one blanket. Well, we have two blankets, and I will mistook to one blanket, people. One. You will see me all the time with my blue blanket. I don't care what you want to say. I just wash it, and I'm me and my blue blanket. Okay. Now, because Alex fall in love with my blue blanket, I have to make sure that me have to protect my blanket. So in order to protect my blanket, I have to get one for him. Now it's very warm and comfy, and we find that it creates some, sense of that mushy feeling that puts you off to sleep. Yeah. So I get him one. So I'll drop a link below of the specific blanket that we use. Hope that you're still able to get it at that texture. But we'll put a link below of the blanket that we use. So check out your bed linen. Pay attention to your bed linen. Sometimes your sheets may have tags. Pay attention if your child, some of these children, they don't like tags, and if the tags tend to touch them, you may have issues. They may get very irritable, and they may try to pull them until they get rid of them. You know what that is. All right. Now, number 4, reduce sensory overload. Minimize the gadgets and stuff that you may use coming on to bedtime. Visual overload, auditory overload. Pay attention to the visual and the auditory stimuli, right? Because these can be very distracting. So turn off the television when it is bedtime. Turn down the music or turn off the music when there is bedtime. Or turn off the music when it's bedtime. Or what you can do is, if you have to play music or if you want to play music, those are more of the calmer music, softer tones that would create that ambience, right, for sleep. Not the loud boogie yaga dancing, whatever. And even if the music is not one of those, no loud music round about bedtime. We want to get into that mode. Number 5, watch your diet. And we're going to talk a little bit about diet and exercise. So here when we talk about diet, try not to eat heavy meals too late at night. Try not to give heavy meals to your children late at night. or even snack. Try not to snack immediately before bedtime. Now, notice I use the word try because it can be very difficult with these kids to manage some of these routine. I am not telling you because it was a one and done situation for us. No, we have had many nights of brushing in teeth 2 3 times because he's back in the snack pan after you brush him teeth and everything, and you thought that okay, it's bedtime. Sometime waking up in the middle of the night is you hear a sound in the kitchen, and then you know that he's up and in the kitchen. So we have had many nights of that, right? But we are putting the tip in there for you to be mindful of these and see how best you can navigate around these. So try to have them eat their heavier meal very early. They can, of course, have a little snack later after dinner, but make sure that the snack is probably more a light one or a healthier one. When we talk about exercise, what I find is Alex does swimming sometimes in the days. And if he spends long hours at the pool or if he goes for swimming lesson, normally after being having enough exertion and stuff, we find that he gets a little bit tired and he goes off a little bit earlier. So exercise or probably some, rigorous activity throughout the day is very good. Engage them in activities because that will help to kind of balance them. Now, know your child because some activity will allow the child to be overstimulated. And as a result of that, you may just have an adverse effect. So rather than the child going to sleep, him start run up and down and hyperactive and everything all over the place. So we have had many nights of that as well. When Alex is ready to fight the sleep, his mode of fighting the sleep is running up and down and have uncontrollable laughter that just really don't make any sense. You don't know him get any joke and him just a laugh, right? And it rough. Me not go tell her say it easy. It just rough. Just talking about it, and these are some of the examples that we ourselves have gone through. So telling you here, we're just telling you how we navigate, some of these areas. So don't make the exercise too much because if you get overtired, it might. So try to create a balance. Whatever you do, try to create a balance. Okay. So diet, try to balance the diet. Try to be moderate. Exercise, try to be moderate about the exercise as well. All right. Number 6, we want to talk about sleep training technique. Sleep training. What do I mean by sleep training? Now, I refer to this one as the withdrawal method. And when I say withdrawal or gradual withdrawal method, now when you implement your routine, right, you have your schedule and you have some little activities that you do, you can withdraw some of the activities. And what this does is create independence because you want to get him to a stage where he can go to his bed by himself, right? So it creates that independence of putting himself to sleep. Okay. Now, not all the techniques will work. I can tell you this. There is no one size fits all approach when it comes to these children, right? So if you try some of these methods or you try all of these methods and they don't work, please make sure you consult a specialist. Talk to your pediatrician, talk to your ABA therapist, talk to your occupational therapist, because sometimes you may have to use medication. Now, we know there was a point we had Alex on melatonin, and most of us, you would have known that that drug melatonin. I drop a link below of the one that we use, right? Make sure anything that you're gonna give your child, discuss it with your pediatrician, right? So we have had discussion with our developmental pediatrician, our medical doctor, and you name it. So we have done our homework. So you make sure as parents you do your homework as well, right? So we were on a melatonin treatment for a while with Alex Xavier. There was a point when the melatonin just didn't work. You give him the melatonin and it just come like he just switch on a light bulb in our head, and that the light come like stadium bulb we just non turn down, and in boom flick straight back till 4 o'clock the next morning. A lot of days we are like zombies going to work. A lot of days I just don't know how I function. A lot of days me don't know how me and my husband function, right? But we went on a melatonin treatment for a while. Eventually, it started working when we combined some of the strategies along with the melatonin, fix a bedtime and all of that. I must tell you though that, while we were doing the potty training became a challenge for our bedtime routine, because a part of our potty training was to wake him up at certain times in the night. Needless to tell you, some night we don't bother wake him up. The last thing you want to do is have the lion wake up at 1 o'clock in the night. All right. So you pick your battles wisely when you are working these routines. So know your non-negotiables when you're gonna work on these techniques, right? We use the melatonin for a while, and we eventually get him to start going to bed at a particular time with the melatonin. We did some research on the magnesium. There are a lot of different magnesium that we find out there. We have done some research on the magnesium, some extensive research, and we find that the magnesium, I think, is glycinate, citrate, and L-threonate. They help to kind of regulate and give you a calming effect in your body. So what we have done, we have tried the magnesium citrate and the magnesium L-threonate with Alex Xavier. Now we started giving him those two magnesium, and we find that it kind of helped to give him a little calm. He was less hyperactive when he started taking the magnesium, and we saw some improvement in his behavior. Now also what happens for us is that we pull him from the melatonin, because there was a point we have both the melatonin and the magnesium going on. But then when we realized that he started going to bed by himself, so we pull back on the melatonin. So just to let you know that we have gone almost 2 months now without the melatonin, and he's going to his bed fine by himself. He's not on the magnesium either, because I think we tried the magnesium for like 2 months, and sometimes the levels of magnesium in their blood is fine and you may be giving too much, right? But these are supplements, but make sure that you're working with your pediatrician and or your specialist on whatever areas or anything that you're trying, right? So we're just giving you some tips. These are things you can read up on, discuss them with your medical practitioner or your specialist, your pediatrician, whoever, whichever your doctor, discuss it with them. They know the tests that they can do, the different blood tests that they can do to make sure that the child levels of these different supplements is okay, and you're not giving them more than is necessary. So we have tried the magnesium route. We find that the magnesium helps settle him, calm him a bit. Then we were able to pull from the melatonin. We went on the magnesium for a little bit, and then we pulled from the magnesium. So now he's not on anything, but we are not having any meltdown and any hyperactivity. And by 9:30 to 10, Alex is ready to go to his bed. So now he knows his routine. By about 9:30, make sure that him have him bath and everything, because you're gonna see him go in and brush his teeth, and he's going to go into his bed, and we will go in and pray with him. And when we pray with him and have our little night talk, good night, love you, see you in the morning, or see you later. See you later is what he normally say. And then he will tell us turn off the lights and close the door, and we exit the room, cover up nice and then blanket, and in the less than 5 to 10 minutes or more, sometimes depending on what activities happen throughout the day, he might go a little longer, but then him, eventually go off to sleep. So guess who have insomnia now, people? The parents. Because after so many years of going through the insomnia period, Now Alex is sleeping okay because he will now go to his bed between 9:30, 10. Sometime he might go level, but he will go to his bed early now. The parents can't sleep. No, we can't sleep. Go see the two away at night time. I try to sleep and we sit down up and look up in the ceiling. Dear, you're sleeping? No, dear. I'm like, I thought you were sleeping. Yeah, that is what is going on now. All right. Sometimes the two away they hug up in the bed and me now try to keep still just to make sure say me not disturb my husband. But then you feel certain movement in the bed and you said, no, sleep no in that the movement there. Dear, you're sleeping. No, dear. Yeah, and there we are. Now the parents end up with insomnia. So we are going to have to go back now and take some of these strategies for ourselves to put ourselves back to sleep. We catch up with Alexia. Number 8, another thing that you can do is try relaxation techniques. So we always, whenever Alex gets in a little hyperactivity mode, one of the things we normally practice with him is this breathing exercise. So whenever he gets a little anxious, we're like, come on Alex, take a deep breath and inhale, exhale, and we model the behavior, we model what we want him to do, and he will try and do it, and have him count to 10 and all of that. So you have little relaxing technique. If your child will allow you, you can probably massage their feet a little bit if they will allow you. I know that some of them are sensitive to touching anywhere and all of that, but if they will allow you, that is something that you can try. And when you're giving them their bath, you can use some essential oils in the bath to and the diffuser to kind of give them that aroma. The lavender oil, as we talked about before, help them with relaxation. So some relaxation technique can help as well. And number 9, last but not least, monitor and adjust your routine. Just be very realistic with yourself. You can try all of these techniques and none of them work, because these children are so different and different things affect them. So if you try something and it don't work, just try something, because listen, this autism journey is really an experiment. That is what we have realized. It's an experiment where you have to just find something work today and something will work today and tomorrow it don't work. You understand? And so you just have to be consistent, right? So monitor your routine, adjust your routine. So track your pattern, whether you want to write it down, jot it down somewhere, or you just want to memorize it if you have good memory and remember everything, right? Now, here's the importance of tracking the pattern. When you track the pattern, you know what work and what don't work. And here's one thing I would say. Don't try everything one time. Because I have seen sometime where some parents, they would have learned about this, they learn about a detox, they learn about magnesium, they learn about melatonin, and they just go and start take all of them one time. And then you might have some changes in behavior. It might be good, it might be bad, but then you don't know which one works. So what I would say is, when you're going to try new things, make sure you start in moderation. Don't have a whole heap of stuff that you're trying at once. I know as parents, we can be anxious when we hear that something work. And of course, when you hear say something work, you go and try because you want a relief and you want it work too. I do understand that. But guess what? Don't try everything all at once. Gradually, try something for a period, give yourself some time, set some goals, set some smart goals, be specific about it. um, Make sure that you do it within a particular time, and then if you see no indication regarding it, then you add something, or probably you want to take away something. Observe your child. You know your child best. You know your child better than even the pediatrician. When you go to the doctor is going to ask you all of these questions. So therefore, you need to just know your child, know what work and know what don't work, right? And adjust the schedule as needed. So be flexible. Be willing to try different approach and find the best one that suits your child's need. Each child is different. Be patient with the child and be patient with yourself. Each child is different. What works for my child may not work for your child. So just take your time, experiment, and find the most effective or the most suitable strategy that will work for your child. With that, we say thank you once again for joining us in this another day in the life of living on Autistic Edge. Don't forget to like, comment, share, and make sure you subscribe. And hit that notification bell so the next time we put out another content, you will be notified.